Here is the reality of heart health and aviation. Most plans fail the moment the trip begins. The displacements, the canceled trips, the reassignments. Well, today, what I'm going to do is show you how to build out a plan that is going to survive your next line. Now, most aviators happen to think that heart health is all about cutting out everything, cooking for hours, grocery shopping like crazy, and following extreme diets. If I were flying this week, this is exactly how I would plan a heart healthy week to work on my blood pressure. Today's topic is all about heart healthy eating for aviation. I'm going to show you a 72-hour hotel friendly system that can or cannot involve cooking. It just depends on you. The problem with most heart health advice, think about it. It's built for kitchens, routine schedules, predictable meals. It's not built for aviation or travel. I don't know how many of you in the past have ever been working with a dietitian or a nutritionist and they start just throwing out data to you. It's so much different when you work with myself, aviation dietitian. Most nutrition advice is not built for the aviator. It's built for people that have kitchens and have a standard 5 p.m. or 6 p.m. dinner routine. What I'm going to do is I'm going to take you through how I build out step by step so that you can see exactly how simple it is and how you can fix your health. In a few minutes, I'm going to show you the one thing that aviation professionals forget that actually makes or breaks your blood pressure and your heart health. Stay tuned so that you can learn these valuable points. In case you didn't know, February is Heart Health Month. Everything that I'm talking about relates to your blood pressure, and if you're a pilot, your FAA medical or air traffic controller. By the way, if we've not met yet, I'm Jill. I'm a registered dietitian specializing in aviation. I've worked now with airline transport pilots for 6 years. I am married to a retired 35-year wide-body captain, and I am currently now working with all aviation professionals. If your plan doesn't work outside your schedule, then it's not really a plan. I want you to let this resonate for a second. Everything that I'm going to show you today is going to be built specifically for you, the aviator, not an influencer in a kitchen at home making meals. So the first thing, let's start getting your system built. You want to think about the reality of your aviation career. You don't have a kitchen, the mini fridge, bets are off whether or not it's going to work or freeze your food. Red eyes and time zone shifts, most people eat at a certain time. You can't necessarily eat at that exact certain time. Airport food, reliable, unreliable, makes you sick sometimes. Who knows, right? You have limited amounts of prep time. If you've got a close schedule, the last thing you want to do is come home, grocery shop, prep food, pack. When are you going to have time to be able to spend with your family? And then it becomes family issues. My system is easy and repeatable. In addition, if you stay till the end, I am going to give you a 72-hour handout, 4 pages, building out the whole system. All you have to do is keep it on your phone, your computer, your iPad, print it out, and you're ready to go. Easy, done for you. Free. The plan that you have must survive your trip. Throwing food away, waste, airport food. Oh, I don't like what I'm eating. I don't want to eat chicken and broccoli, day 500. Oh, I got a delay. My food hasn't been refrigerated for X number of days. I'm afraid that I'm going to get food poisoning. We know if your plan does not work for a 3 or 4 day trip, then it's not going to work. This is my 3-part heart health system. As I see, I have a misspelling there. Pre-flight is reduction of decision fatigue. When you have food with you, You don't have to make the next decision. All you have to do is go into your bag and it's right there. In flight, eating at scheduled times gives you predictability in rhythm and reactions of your body. You can think clearer, you can process things. Post flight is all about restoring your recovery for the next day. We all know about fatigue and sleep issues. And if you're not eating properly during that post flight recovery time, then the next day is going to be complete garbage. This is my pre flight. You remove the decision fatigue. Think about this. Recipes require motivation. We don't have time for recipes. I teach combinations. That all it requires is just structuring every single meal in a certain aspect. If you like the idea of a repeatable 72-hour trip template, it is going to be available on the link below for you also. Step 1 is a 1-basket grocery run. Step 2, packing for 72 hours, about 3 days. Step 3 is building combinations, not recipes. In flight, what we're trying to do is we're trying to protect your rhythm. We want to have protein and fiber at every single eating window. Second, we want to make sure that we are pacing our hydration. Now, I'm going to pause for a second because if you've not watched my video on hydration last week, I want you to go there and watch that. It's very valuable information. It's the first step in perfecting your blood pressure. The third option in in-flight eating is I want you to avoid long fuel gaps. Think about it this way. You're going to choose a portable protein. You're going to add some fiber, which is fruits and vegetables, which creates stability for your blood pressure and your blood sugar. You're going to add a plant-based fat to keep you satisfied and full and to keep your heart protected. And we are going to control hydration so that it's intentional. Remember, in that video, if you've watched it, I said you want to continually be sipping, not guzzling. We want to have predictable inputs, which predict your output of how your performance goes with your body. In post-flight, you're thinking about that controlled recovery. You want to have intentional hydration. Just because you're at the overnight hotel does not mean that you stop drinking fluids. You want to have a simple, balanced dinner, not picking the biggest restaurant with the biggest portions. Leading into sleep. Everything that you've done for that recovery, your hydration, your dinner, is going to support your sleep structure for the evening. Heart health is built on repetitive habits, day after day, doing the same thing consistently. It's not one perfect meal. It's not lack of hydration. It's not terrible sleep. It's just building those stepping stones every single day. The whole process actually perfects the system and keeps your body at ease. And that's exactly why your blood pressure ends up being so well, is because the body is calm and knows exactly what to expect. Think about timed meals. Your body knows that the food's coming in and it's not going to get stressed out. Less stress, less inflammation, better biometrics, better blood pressure, better blood sugar. Now, I want to give you an example of a client that found my system and applied it. This client came to me not eating all day, 8 hours in the aircraft, not eating anything. His blood pressure was insane, absolutely insane. After about 2 weeks, it took him a little bit of time to really decide that, okay, I think I can go grocery shopping. I think I can do this meal process. And now he is a raving fan. His blood pressure is 120/80 or below. I haven't talked to him in a couple months. His doctor took him off of blood pressure medication. After 3 months, we were able to see that his blood pressure kept trending downward. So it was the consistency of the program that I teach that led to his improvement. He no longer stresses at all. Now let's think about inconsistency. It's the most overlooked. Remember when I told you that I was going to tell you a secret? This is a secret. The most overlooked blood pressure issue is inconsistency. Long gaps between eating windows, long gaps between hydration causes stress responses in your body. Everything gets twitchy and weird. Your blood sugar bottoms out. You get dehydrated. Your heart has to strain because your blood is thick. Irregular eating means that you're having reduced energy. I don't know if you know this or not, but when you don't eat for so many hours, your body has to go into what's called gluconeogenesis, goes into the liver and gets out that storage from the last meal or the last few meals that you've eaten and has to turn it back into food. And that is very stressful on the body. The body responds very poorly to unpredictability. Think about the cabin air dryness, dehydration, the missed meals, body's looking for food, ill timing, no snacks, variability with your blood sugar increases your blood pressure. Now, what you've waited for, how do we build this system? The first thing I do is I build a one basket grocery method. It builds combinations, not recipes. This is exactly how you can eat anywhere you are. Look at all of the things: protein anchors, fiber content, fruits and vegetables, plant-based fats, carbohydrates, followed up with hydration. Very, very simple. This is the template for the inspiration. You do a high protein pre-flight meal, for instance, rotisserie chicken, torn off, adding some shredded cabbage in a wrap with some guacamole or an avocado cup. My templates that I'm going to provide you after this video eliminate the guesswork and reduce your decision-making fatigue. Everything is laid out for you. Packaged foods also help when you get reassigned. Say you get reassigned over an international border. If all of this was in a package, not the chicken, you could still carry it with you and you'd have food for that international border overnight. Another option is a no fridge, no time backup plan. I have a lot of clients that do this. A bowl template, packaged yogurt, some fresh berries, a nut butter packet, and some low sugar granola. Could be eaten breakfast, lunch, dinner, snack, you name it, whenever you're hungry. Next up, I have something between legs. You're still hungry and you're looking for that next snack, a snack box template. Protein, you can get pre-cooked hard-boiled eggs at the store, some baby carrots to dip in hummus, and then some pumpkin seeds. Pumpkin seeds also have magnesium, which really helps with your muscle contractions and it helps with sleep. So it's a great little snack if you're headed to the overnight and you're going to go to sleep. This is what professionals do. They use systems. They protect their health and their future. Think about predictability, control, calm health, long-term protection, retirement, and beyond. I want to thank you so much for coming today and watching this video. If you want the handouts, there's a freebie that will be in the show notes. And this is exactly what it is here. There's going to be a wrap template, a bowl template, a snack template, and a one basket grocery list that you can shop from. Of course, I hope that you'll continue to watch and subscribe. I also hope that you will give me a follow on Instagram. Find me on Instagram for more tips and tricks. If you have any issues with blood pressure or you think that you're close to losing your medical, this is where I want you to get the link below. Send me an email or sign up for a free call so that we can discuss your blood pressure at length and figure out how to resolve it together. Thank you so much for watching. I will see you next time.